Is there a message of necessity at the desk? There is a message of necessity at the desk. Move to accept the message of necessity. The message is accepted.
Hello, everyone. My name is Kyle Davis. I'm the Director of Public Affairs at the Empire Center, and I have the privilege to sit down with Bill Hammond, the Senior Fellow for Health Policy at the Empire Center. How are you doing today, Bill?
Very good, Kyle. Thank you.
So we have had some you've been doing a lot of work, I should say, on obviously health policy, but some of the stuff that's been going on in Washington, D.C. Cuomo recently testified down on the Hill. Why don't you give us a little synopsis of what that was all about?
So this goes back to Cuomo's actions during the pandemic, and in particular, his infamous March 2020 directive, which sent COVID-infected patients from hospitals into nursing homes. There's a House subcommittee on the coronavirus pandemic, which has been investigating various issues about the pandemic, including Cuomo's directive. And they, over the past year and a half or 2 years, they've interviewed a lot of people, a lot of former Cuomo aides, the former health commissioner. Finally, they interviewed Cuomo himself. And then on Tuesday, September 10th, they held a public hearing. And Cuomo was the sole witness. And so there was some kind of high drama because this is a Republican committee, or at least a Republican-led committee. They issued a report summarizing their findings, which was very critical of what he had done, and so he kind of went in loaded for bear. Right? He has denied any wrongdoing in connection with nursing homes in that order. He has characterized the attacks on his policy as being driven by, Trump fanatics and MAGA Republicans, and so that was kind of the case that he made, and then he got an earful from both the chairman of the committee, Brad Wenstrup, but also Stefanik was there, from New York State, a rising star in the House Republicans. He's not technically a member of the committee, but she was allowed to sit in on this hearing, and she came down hard on the governor. Marjorie Taylor Greene was there. She came down hard on the governor. Nicole Malliotakis from Staten Island. She wasn't as hot as Stefanik and Marjorie Taylor Greene were. She devoted her time to fact-checking an op-ed that Cuomo had written, and she did a very good job of that. So it was an opportunity for Congress, the world, the press to kind of revisit this sad moment in New York's pandemic. I guess the question is what came out of it, right? Like the committee, they came to some conclusions, most of which kind of confirmed what we knew or thought we knew. So, for example, that this infamous order came from the governor's office. It seems to have come after a conversation that the governor and some of his aides had with a major hospital group called the Greater New York Hospital Association. This was the first investigation which officially found that the order was inconsistent with federal guidelines. That was kind of new. And then they also dug into the development of a report that was published under the name of the Health Department, but which was actually written, or at least rewritten, by the governor's aides and possibly by Cuomo himself. They took out some of the data that in particular, they changed the count of how many nursing home residents were reported as having died. They took one subgroup, the people who who had gotten sick in the nursing homes and been transferred to hospitals. They omitted that from their count, and that reduced the death toll by about a third. It made the state's pandemic in nursing homes look less serious than it really was. That ended up becoming a scandal of its own. So they dissected what happened. They exposed it to the light of air. They put a lot of officials on record, not technically under oath, but they weren't in a position to lie to Congress. One sort of surprising thing that came out of it is that Governor Hochul had apparently not been cooperating. They went to her with sweeping requests for documents because they really wanted to get to the bottom of things. And at first she ignored the requests, and then she told the committee that they'd gone to the wrong place. They needed to talk to the health department. And then eventually the governor produced hundreds of thousands of pages of documents, but most of it was not pertinent to what they were investigating. The documents that they really wanted were held back. This is probably an experience that'd be familiar to anybody that's filed a FOIL request with the state. You get kind of a runaround. It's just kind of surprising that they would treat a bona fide congressional investigation that way. And I guess to me it was a little surprising that Hochul would be effectively running interference for Cuomo and the Cuomo administration at this point. So go ahead.
No, so you're saying that she kind of stopped the flow of information from your perspective in terms of getting stuff to the congressional.
So they wanted to really know, for example, who wrote the March 2020 order?
Right.
How did it evolve? Whose idea was it? Where did it come from? And so therefore they needed to see kind of all of the original drafts with, like, presumably somebody originated the order and it would be emailed from that person's account to someone else. And they wanted to know that chain of events. They also, and so they figured all of that would be in the emails that the governor's office and the health department had in their records. And in fact, I think the governor acknowledged, yes, the state does have some of that stuff, but we consider it to be privileged, and so we're not giving it to you. That actually wasn't clear at first, but the committee sort of said, hey, where are all these emails? And they said, we want something called a privilege log. And that's a kind of technical term used in litigation, I guess, where the party that's holding back records has to kind of summarize what those records are. So it'll say, this was an email generated on such and such a date by such and such a person. Its contents are privileged for the following reasons. And so they got this privilege log and they went through it and they said, look, you're citing privilege that doesn't really exist here, or you're doing it inappropriately. But that privilege log at least let them know that they had the type of records that the committee was looking for, and they weren't getting them. So now one of the things that happened on September 10th is the committee announced, we're going to subpoena you. So that's like a legally enforceable request for records. And if the state doesn't comply, they're going to be in court.
Do you think that those emails will eventually come to light, or do you think that they will probably remain hidden?
So a lot of that depends on the outcome of the elections in November, Kyle, because this committee is currently being run by Republicans because it's a Republican majority in the House. It's the kind of the descendant of a committee that was created by the Democrats when they were in control and when Trump was in office. And under their management, it focused largely on coronavirus issues that happened in the Republican Trump administration. when the Republicans took over, they kind of branched out and looked at things that were done by Democratic governors. If the Democrats retake control of the House, I would expect this investigation essentially to stop, or at least that's a strong possibility. And so
That makes sense.
that sort of means there's kind of a deadline. So, the people running the committee are aware that things could change come January, and they're trying to get their job done before.
Absolutely. So there was a hearing, a week or two ago, but what you've discussed largely came in the report, the actual report that the committee issued, correct?
Yeah, it issued. It's called an interim or a preliminary report because there's still some questions that are unanswered. But it was like a 48-page memo. It came out on the Monday before the hearing, and it goes through in great detail like what they found and like what the evidence is for their various findings.
So based on the hearing and the committee report, is there any obviously the emails are missing, but is there any other questions that remain unanswered that are of top of mind to you, Bill?
Oh yeah. No, I mean, I sort of the three big ones are why did they issue this order the way they did? So I guess we need to get into a little bit of detail here. The order said, we're in an emergency. Nursing homes need to comply with the expedited receipt of patients coming out of hospital. So that was one part of it. And then the next part of it is no admission shall be denied solely because of a COVID case. So that was basically saying you can't, just because somebody has COVID, you can't turn them away. And then finally it said, also you can't demand a negative test you can't even demand a test of any kind for COVID before you accept the patient. Because it was an emergency, this was issued in March 25th, 2020. It was like the thick of the crisis. It was interpreted by most nursing homes as being a mandate that they had to take these patients. And a lot of nursing homes thought this was a terrible policy because you're basically knowingly shipping a dangerous virus into a facility full of vulnerable elderly people, frail and easily subject to infection. So why would the federal government's guidance kind of went the other, well, almost you could argue went the other way. It said you can send these patients into nursing homes, but only if the nursing homes are prepared for them. And that's a big if, that's a big caveat, because a lot of nursing homes were completely overwhelmed during the pandemic, even just because their staff were getting sick and they didn't have enough people and they were running out of PPE. So this order was kind of an added burden on them during a very difficult time. And so the question is, why would a state issue an order like that without consulting the nursing homes, without helping them deal with this challenge? So there's a lot of kind of swirling questions around that, and I think we still don't know for sure. We have ideas about where it came from, but we still don't know for sure exactly where it came from. And then another big issue is why the governor later covered up the number of deaths in nursing homes. He did that, as I said before, by leaving out a group, about a third of patients who technically died in hospitals, even though they got sick in the nursing home. He had to know when he started playing with the numbers that way, he had to know he couldn't do that forever. He was going to have to acknowledge the existence of these other deaths at some point, and it was going to be a huge news story and scandal, which is exactly what happened. He postponed putting out those numbers for almost a year, and then when they came out, it was a scandal, and everybody's like, why were you covering this up? And in fact, it was one of the issues that led to his the impeachment inquiry and eventually his resignation. So the mystery to me is why he's not a political idiot, right? Like he's sort of known for his, understanding of how politics works. Why didn't he see that coming, and why would he go down that path in the first place? I guess there's some thinking that it was he was concerned about his public image when he was negotiating his book deal. That may have been a consideration. And then, like I say, I think the third mystery is why is Governor Hochul giving him cover? Why did she withhold those records? To me, this is all this is one decision that was among thousands of decisions that were made by state officials during the pandemic. Some of those were right decisions, some of those were mistakes, and we focused on this one because the governor, was so squirrely about it. He held back the information, and he denied the facts surrounding it. There are many others that need a similar kind of autopsy, like, what went wrong and what went right. And the very, like, not just the Cuomo administration, but now the Hochul administration is kind of standing in the way of clarity about these things. And this is an argument to me that we need an independent commission established to, completely assess what the state did, figure out what could be done better, and learn the lessons of the coronavirus so that we're prepared for the next pandemic.
Absolutely. I think it's tragic that there hasn't been a deeper analysis done into the, obviously the pandemic response. I know that there's been, short reports that the governor's office has put out, but nowhere near the scope and the breadth that you're talking about in terms of really digging into the problem, correct?
She hired a consultant. The consultant's approach was basically to interview the people who made the decisions. They even did kind of a survey of the officials who were involved. But it wasn't coupled with the kind of statistical analysis to say they did these decisions for this reason. Did it work? Like what was the impact? Instead, the consultants just sort of said, here were their reasons were valid and therefore okay. Like it was a very superficial report. It was also kind of sloppily put together. It had a lot of factual errors in it. I don't think it was anything close to what we need. And by the way, the governor who commissioned that report and spent millions of dollars on it has not said one word about it. She hasn't said,
Right.
I think it's fine. I think it's inadequate. She hasn't said, here are the steps I'm taking to implement its recommendations. It's been crickets. So that's kind of shocking. And by the way, I think actually when the governor says, hey, you're coming down like a ton of bricks on me, what about all the stuff Trump did? He's deflecting, right? It's kind of an excuse that he's making, whataboutism and all that. But we really do need an investigation at the federal level too. There were a lot of mistakes made at that level. And every state should probably do an investigation. One state that I know actually did one was New Jersey, and it was a useful exercise for them. I hope that they take it to heart and reconfigure their public health system based on what their findings were. But New York has not done that. The federal government has not done that. And people just don't seem to have the stomach politically. They don't have the stomach for reopening that wound. It's like they want to pretend like it never happened.
So, Bill, I think there's probably a lot of people out there that aren't super familiar with the role that the Empire Center played in kind of uncovering and making sure that things were transparent during the pandemic. Would you be able to just kind of give us a brief analysis of, what some of the highlights were in terms of the work that you did, which was very important and very critical in uncovering some of this during that time?
It started out as just kind of a small routine thing. The this issue about how the state and the health department were reporting nursing home deaths was getting attention. The health commissioner was called to testify before the legislature. They asked him, hey, we understand you're not telling us the full count of nursing home deaths. What is it? And he said, I can't tell you. Well, I'm not ready to give that information. And so I said, okay, I'm going to foil it. August 3rd, 2020. Predictably, the health department put me off. They said, we need more time. We need more time. I appealed those decisions. And then I had the advantage of having access to Cam McDonald and the Government Justice Center, which is, it's a public interest law practice, and one of their reasons for existence is to fight freedom of information cases. So we went to court with them in, I believe it was October of 2020. It was, things in court take time, but we eventually got a court order saying, yes, the health department is violating the freedom of information law. They need to give you these records. And so they under court order, they finally gave us the records on February 10th, 2021. That, like I said before, the fact that he was covering this up became one of the issues that he was subject to an impeachment inquiry over. And so the Empire Center, by bringing that court case, helped shine a light on what he was doing. Both when he was resisting the court case, people were writing about why is the governor holding this data back, and then when the data came out, it was it showed large numbers, and it was shocking, predictably shocking, and there was a lot of uproar about why he had held those numbers back.
Recently, one of your reports was kind of criticized by another group. I don't know if you want to touch on that briefly and kind of showcase why, maybe some of their erroneous thinking and why you believe your report still stands credible today.
So there's a guy named Paul Francis who is a very sharp guy. He'd been a health policy advisor in and out of state government, going through 3 governors, so Spitzer, Patterson, and Cuomo. But he did work pretty closely with Cuomo. He was part of one of Cuomo's policy advisors, and for a while he was in the governor's office as a policy advisor. He left and formed his own think tank. And a few weeks ago, I got a call from him, and he's like, "Hey, Bill, I'm going to write about this nursing home issue. Do you mind sharing your data?" And the Empire Center, a former colleague, Ian Kingsbury, and I had done a report. When we got that data, we had done a report kind of statistically analyzing the transfers from, the transfers of infected patients into nursing homes and the death rates in those nursing homes. And we found a correlation that there was higher death rates in the nursing homes that had accepted these patients. And so Paul was going to try to reproduce that research, and I sent him the data. And then he came out with a report basically saying that my work with Ian was wrong, and that we had sort of insinuating that we had trumped this up to make Cuomo look bad, or at least that we had exaggerated the significance of our findings. And I realized he published this in op-ed form the Sunday before Cuomo's hearing. And I realized, okay, this is sort of part of Cuomo's rehabilitation campaign. At least that's how it looks to me, that, a former aide of the governor is out there trying to defend what the governor did and to attack one of Cuomo's critics. So when I looked at what Paul wrote, I realized he had misconstrued our research. He had either misunderstood or distorted our methods and our findings. And so I pushed back and I said, he made a mistake here. I mean, I'm waiting to hear back. Ian and I asked him for a correction. We're waiting to hear back. We'll see what he says. But I mean, he made like just plain factual errors in reading our findings, but then also in his own analysis, he kind of screwed that up as well.
All right, Bill. Well, we are getting close to the end here. Is there anything that you want to say, kind of in summary, that you think the audience should take away from the podcast episode today?
Well, like I said before, the pandemic was just a huge. I think it's funny how memory is kind of already fading, but it was an awful time. It was awful both because of all the people who were dying, including just tens of thousands of New Yorkers were dying. It was the worst natural disaster in 100 years, at least. And in addition, the precautions we were taking were just a huge disruption, right? Like we weren't able to have family gatherings, and we weren't able to leave the house and shop as we normally do. And part of the reason it got so bad is because we weren't well prepared and we didn't know what we were doing. Now, that's partly because it hardly ever happens, right? It was a new experience. We can't let that happen again. We have to be better prepared next time. We have to learn from this. Is like the other side of this is that this was like a training session for us, right? Like this is teaching us what can go wrong in the pandemic. And so next time we need to have a better plan for how to handle nursing home patients. We shouldn't be making it up on the fly, and we probably should never again send infected patients into a nursing home. We need to have that conversation. We need to go through that process. It doesn't need to involve you and me. It's something that the experts should be doing. And if they do that well, the next time a virus comes along, it won't become as big of a deal. It won't kill as many people. It won't disrupt our lives. It'll be something that's going on under the surface that the bureaucrats take care of, and that should be our goal. And I haven't seen any evidence of that process happening where the state takes all of this to heart and reworks their public health system. In fact, they've continued to allow the funding for public health to decline, and so yeah, it's discouraging.
Well, Bill, I always appreciate your perspective, especially, you always, obviously COVID is now in the rearview mirror. It's a few years away, but you always look towards the future and how you can make the future better and make sure that, we don't fall into the same traps that we fell into a couple years ago. So always really appreciate that take. I do want to thank everyone for tuning into this episode of Messages of Necessity. We put these podcasts out on about a bi-weekly basis, so stay tuned for our next episode in 2 weeks. Otherwise, Bill, it was great talking to you, and we will see you all again soon.
It's a pleasure.
For more news and analysis, visit our website and sign up for email updates at empirecenter.org. Follow us on Twitter, Facebook, and LinkedIn at Empire Center.